Hi everyone. Look, I'd also like to start by acknowledging on the lands of Ngunnawal people and their respects, elders past and emerging, and also particularly thank any Aboriginal and Torres Strait Islander people here today and Volunteering Australia for the opportunity for us to again kind of talk about and present our the findings from the data collection. So as Jack mentioned, this is work which was funded and supported by Volunteering Australia. So there's a couple of us on the paper, Matt and I, but also Charlotte Boyer and Maria Jaromi from the Centre for Social Research and Methods. So it was definitely a team effort, including both us within the ANU, but also the quite genuine collaboration between Volunteering Australia and the research team. So essentially the work which we're going to talk about, so we'll probably go for about 15 minutes or so working through some findings, which particularly focuses on the experience of volunteers during the COVID period, but also those who hadn't volunteered either leading up to or during the COVID period, what their views were on why they didn't, as well as what the potential future kind of volunteering workforce, for want of a better term, might be into the future. So our data is available to anyone if you want to access it through the Australian Data Archive. So in addition to the summary findings which were presented as part of the report, which Jack mentioned, we're also made the data available, and we're more than happy to chat to organisations or others who might be interested in having a look at the data themselves, seeing how your organisation might be have specific insights for your organisation, whether it be as policymakers or as those who are delivering kind of volunteering services or providing support for volunteers. So just a bit of a background, the survey is a nationally representative survey of adults, so we are missing kind of that really vital element of kind of children and youth volunteers, but it is a nationally representative survey. It has about 3,500 respondents across Australia, and we also boosted the sample for some of our smaller states and territories, in addition to kind of the national survey, so we can get both national as well as state and territory insights into the experience during the COVID period. So I'm just really going to work through a couple of the key findings, what we think are the key findings, but there's plenty more in the paper and plenty more available for you to look at yourself. So we started off with really simple measures just to get a baseline of, or not a baseline, but just to get a sense of kind of who's volunteering both formally and informally as we came towards the end of the COVID period. So this data comes from April 2022. Probably is a little bit ambitious to think of it as the end of the COVID period then. I heard someone mention during the keynote today that we're now at the end of the COVID period. I think that's also maybe a little ambitious, but we all have positive thoughts, and hopefully some of you will have seen some of our students now back on campus, and hopefully they're having positive thoughts about their 2023 kind of student experience. So anyway, so April 2022, about 27% of adult Australians had volunteered had undertaken formal volunteering in the previous 12 months. A much larger percent had undertaken informal volunteering in the previous 4 weeks, so not through an organisation, leading to about 57% of Australians who over those two periods, the previous 12 months and the previous 4 weeks respectively, had undertaken some form of volunteering. So this won't surprise you, but substantially more than a majority of Australians had undertaken some form of volunteering, even during a time when there were still restrictions and challenges for volunteers due to kind of ongoing COVID restrictions. So a high rate, but a declining rate. So one of the real benefits of our survey data is that we're able to make comparisons not only at the national level, but also for individuals. So we're able to track individuals through time and get a sense of how people's experiences had shifted and changed over the COVID period. So just prior to COVID, there was all participants in our kind of survey program were asked about a range of questions, but one of them was on whether they'd volunteered in the previous 12 months. So we found for males about 34% and females about 38% had volunteered in the 12 months leading up to the end of 2019. So it's a little bit higher than say you get in the census, and it's a little bit higher than what you'd get in some of the ABS surveys. Mostly that's due to the way kind of the question is asked, but also people who kind of volunteer to respond to surveys tend to be slightly more likely to volunteer generally. We control for that as best we can, but it may be a little bit higher than some other surveys find. But the important thing is that we ask the same question and we track the same individuals over the COVID period. So in April 2021, which was the first time we asked this question during the COVID period, the volunteering rate had dropped to about 23% for females and 23% for males and 25% for females. So a substantial drop using exactly the same sample and exactly the same question into the start of the COVID period. That's not going to surprise too many people that there was that drop. But even by kind of early 2021, when most of the restrictions in Australia had eased compared to at least early 2020, there had still been a substantial decline in volunteering. What was perhaps a little bit more surprising for us is that over the year which followed, there wasn't perhaps as large an increase or a return to a return to kind of pre-COVID baseline as you might otherwise have expected. So paid work by or number of hours in paid work by April 2022 was about back to what it was pre-COVID. There was some variation in who stopped paid work and who didn't. But for volunteer work, both in terms of number of hours, but also just people volunteering at all, still hadn't approached anywhere near the pre-COVID baseline. Slightly, or some differences between males and females, but really the bigger differences were by age. In terms of kind of main demographic characteristics. So what we found is that for 45 to 54-year-olds, there was an almost halving in the percent who volunteered in the previous 12 months, from being one of the highest rates pre-COVID to being one of the age group with one of the lowest rates during the COVID period. And for those who are juggling homeschooling, including me, it's probably not a huge surprise why for that age group there were particular constraints early on in COVID. But I guess one of the real concerns is that even by kind of April 2022, when most of kind of those constraints of people's times had almost kind of disappeared, that age group still was still kind of at the lower kind of end of the age distribution, or lower compared to most other age groups, and certainly far lower than it was pre-COVID. So there's clearly aspects of the COVID experience which impacted different age groups differently. And we certainly found that the declines weren't kind of consistent across the population. We also found some real differences by where someone lived. So remembering that this is in April. Yep, remember this is in April 2022 when not long after kind of New South Wales, Victoria, and the ACT had come out of lockdown, that there was that those states and territories had the highest proportion of people who said that they'd stopped volunteering due to COVID. So this is a slightly different measure. This is a direct measure saying, did you stop due to COVID? So the previous measures were just whether you were volunteering or not, but we also asked people specifically whether it was because of COVID. So New South Wales, Victoria, and the ACT, about 50% more, or close to 50% more people said they'd stop volunteering in those states and territories. Now, remember, this is after the kind of restrictions in those jurisdictions had eased. It was more or less back to what it was in the rest of the country, but still there are lingering effects, lingering impacts of that differential kind of COVID experience. And the second graph on the right also gives the same figure, which is the percent of people who stop volunteering, but now it's by some other characteristics of the respondents. And in particular, when we kind of did our detailed data analysis, these are kind of some of the three measures which turned out outside of demography and geography to be particularly kind of predictive of whether someone stopped volunteering. So whether you had financial difficulties during COVID was strongly correlated with whether you stopped volunteering. Now that all these make sense, but I guess what's important is to confirm some of our intuition with data, but also to kind of show the scale and the size of those differences. So if financial difficulties, if you are under financial stress, then obviously you have time constraints, you have a kind of stress, and you have all those kind of barriers to engaging in volunteering, even if pre-COVID you were able to. So of those with financial difficulties, 36% said that they'd stopped volunteering during COVID, compared to about a quarter of those without financial difficulties. Those who so this is not people who became either sick or disabled during COVID or due to COVID. This is kind of pre-existing characteristics. Those who were permanently sick or disabled kind of leading up to COVID were also more likely to have stopped volunteering. And that kind of makes sense when you reflect on kind of some of the kind of particular risks of kind of COVID-19 and the types of activities which volunteering entails, which people may feel put them at a particular risk due to kind of infections and some of the consequences of COVID. So about 38% of those who are permanently sick or disabled said they'd stop volunteering, compared to 27% of the rest. And also a much larger decline for those who, based on a battery of questions, were identified as having high levels of psychological distress. So mental health, physical health, and financial health were all predictive of stopping volunteering. Now remember, these are people who were volunteering pre-COVID. So this is not saying that these are long-term barriers and that COVID kind of exacerbated these barriers, although that may also be true. This is people who are volunteering leading up to COVID and whether they stopped. So this is people who may have had financial difficulties pre-COVID, but the effect of COVID may have made it harder for them to maintain their volunteering, and the same with some of our mental and physical health measures. So quite big differences across the population, and people who, and I'll get to kind of the relationship between kind of volunteering and wellbeing in a second, people who might be getting some of the intangible benefits from volunteering, which we've already heard in the keynote, and we all know with our own experience, which people get from kind of volunteering. Another question which we asked was, looking forward to the future, and then we didn't know this at the time, but kind of a nice segue into the title of the conference. We asked people who are currently volunteering whether they intended to increase, decrease, or keep their hours about the same. And we also asked people who'd stopped volunteering or who had never volunteered before, their intentions to volunteer into the future. So in the paper, we kind of look at who, why, what type of volunteering people would do if they were to either commence or recommence. But the general kind of overall finding from these two questions is that even if people follow through completely with their intentions, the volunteering rate is still not going to return to what it was pre-COVID. And we know that people struggle to follow through on their intentions, even if they have kind of every desire to do so. But even with that, the proportion of people who said that they would start or restart volunteering was not enough to kind of fill that gap which emerged during COVID. And we know that even leading up to COVID, there had been a kind of a long-term, not as kind of drastic declines, but there had been long-term declines leading up to COVID. And of course, that all matters for kind of people's for those who rely on or make use of the services or goods which volunteering provides. But we also spent a fair bit of time in the paper really trying to understand what this might mean for people's the well-being or the outcomes of volunteers themselves. So leading up to COVID, there was a pretty consistent set of research which showed that those who undertake volunteering have high rates of well-being, lower rates of loneliness, higher rates of kind of social interaction. And our data and data in other jurisdictions as well, other countries has shown a similar thing, that those who stopped volunteering during COVID, that it had a substantial impact on their well-being. And we're able to show this because we had people's, for the same individual, we had their well-being measure pre-COVID. We had measures of whether they volunteered or didn't during the COVID period, and we had their well-being as of April 2022. For some people, it had no impact. And we also, I should note that as part of the survey, we tried really hard to, as best we can in these types of kind of online surveys, really emphasize the voice of volunteers themselves. And you'll see some quotes here, as well as some quotes in the paper. So some people, COVID actually had a positive impact. People felt that they were able to contribute in ways which they weren't able to before, or saw, that there was a kind of a national emergency and they were able to contribute. Some people volunteered in ways which they didn't before, and we really shouldn't, or we try really hard not to kind of negate those positive experiences. But on balance, there was a decline in well-being for those who stopped volunteering, and also additional stress for some who maintain that volunteering. So not only is there kind of direct evidence of this kind of decline, which is going to impact on as I said, those who are in receipt of services or goods from volunteering, but also that a real negative impact from COVID on those who were volunteering pre-COVID, but then for whatever reason stopped during the pandemic. So as I said, this is really a quick run through some pretty extensive data in the report, and we really encourage you to have a look at it and reach out to us to have a discussion if it's something you're interested in. But some real key findings. One is that there was a decline early on, and that it did not return to what it was rates kind of pre-COVID. Those who did stop had different characteristics to those who are able to continue. And we talked about some differences by age, by geography, by health and other well-being measures. There was some shift towards virtual volunteering, but that was not as large as perhaps we may have thought, kind of going into the survey. And also, I guess the final point, and this is a real challenge, particularly a challenge in light of the keynote address earlier on and the strategy, that there is a real need to engage with those who maybe hadn't volunteered in the past, but in particular find ways to encourage or support those who had stopped volunteering to re-engage, not only for the communities which volunteers serve, but also for those individuals, given what we know about kind of the health and social benefits of volunteering. I'll leave it there, Jack. Thanks.
Really interesting presentation. It's great to kind of get a sense for what's happened with volunteering over the past few years and how sort of where we've landed now with the launch of the strategy. So yeah, thanks so much for that. But we also wanted, as we were preparing this research, to understand volunteering from the perspective of organisations. And I know there's a lot of people in the room who might have been involved with that research. So as Sarah mentioned at the plenary this morning, so thank you for that. And to hear a bit more about that, I'll pass this over to Kirsten Holmes. And apologies from Leonie, Lockstone-Binney, who was unable to be here this afternoon. Yeah,
thank you. Thanks very much. Just checking that's clear enough. So yes, I am presenting the presentation this afternoon on my own. I'll talk about our team in a moment, but I just also wanted to acknowledge the traditional owners of the lands on which we're meeting. I also wanted to acknowledge that we collected data from organisations across Australia, where across hundreds of traditional lands and custodial groups in Australia, and pay our deepest respects to their ancestors and members of their communities, past, present, and their emerging leaders. So I think this is really important to have these two presentations side by side. To have volunteering, we've got to have people who actually volunteer, but at least with formal volunteering, we've got to have ways in which they can volunteer. We've got to create ways and opportunities and organisations for them to volunteer. So that's our overview here. And time we're going as well. So this is the team. Again, this was a team effort. This was a team project. So I led the team, but I think it's really important to note that Leonie and Patrick Dunlop here led the actual survey. They are the quantitative specialists. So I'm just giving you that little disclaimer that I'm going to do my best to present the data here. But if you have any specific or technical questions, I might have to take those on notice and I can get them back to you after the session. So our methodology, a little bit different, and we were doing it slightly later than the first survey that you heard about. So ours was May and June 2022, and we were looking for representatives of Australian volunteer involving organisations. You may be aware, you may not, there is no actual list of all the volunteer involving organisations in Australia. So we had to use multiple methods to try and contact organisations, and clearly there are some groups that might not have been contacted by us, and I think this is a really important point to think about going forward, is we don't actually have like an accurate picture of what the volunteer sector looks like here in Australia. I think that's quite an issue. So we used a whole range of different methods to try and attract responses. We had 1,345 usable responses, which is the largest ever survey of volunteer involving organisations in Australia, even though there are a lot more organisations than responded to our survey. And we did do a couple of focus groups as well nationally to follow up and to get some more qualitative and in-depth responses. And I ran those focus groups, so if you've got questions about the focus groups, all on for those. So to give you a bit of information about the organisational size. So we did get equal representation in our responses in our sample from small, medium and large organisations. But it's really important to know that most of these organisations are pretty small. So half of them have 50 volunteers or fewer, and 61% employed less than 10 staff. So, you know, they are small organisations. They would be categorised as small and medium enterprises. So we do have a number of large volunteer involving organisations which probably have a lot of attention, better resourced, but a lot of small ones, so which you would all be very familiar with. And volunteers involved, so in lots of different ways, but primarily it's traditional volunteering. So almost all the organisations have volunteers involved in ongoing, regular roles, and it's face-to-face, it's in person. So that's the majority. We can see some other groups. I mean, 2/3 are doing episodic volunteering. It's been around for quite a long time. Smaller group, it's inching up to 1/3 doing micro volunteering, and we were hearing a bit about that this morning. And you know, quite a sizable number involving their volunteers remotely over the internet. Now, this was the first time we run this survey, so we don't have the benefit of the longitudinal approach that ANU had. So we can't say if it would have been significantly, you know, if that 39% on the internet would have been significantly less if we'd just done the survey a couple of years earlier. But, you know, we can speculate that that would be quite a big change we'd expect to see as a result of COVID. So this is demand for volunteering, which I think is it's the opposite side of the coin from what we just heard about in terms of volunteer participation. And you can see that there's been a decline in volunteering and most organisations need more volunteers. What we're seeing is they only need a small number of more volunteers. And I guess this reflects that they don't have most organisations don't have large groups of volunteers anyway. So they only need a few extra. But I think that really raises the potential risk of burnout, the risk that volunteers are, you know, are having to commit over capacity. Organisations don't quite have enough volunteers, and I think that's challenging. In our paper, in our report, which is on Volunteering Australia's website, we don't report any differences between states, areas of operation or organisational size. The data are available if anyone wants to go in and do some subsequent analysis. But we did note that there seemed to be greatest demand in sort of mental health, emergency services, health, education and animal welfare volunteering. So some particular areas that seem to be struggling a little bit more. And then thinking about future demand, 60% of organisations said they would need more volunteers, and putting this in the context that we've just heard about volunteers not so likely to come back into volunteering. So that 60%, how far are they going to have their needs met? It's quite a significant question. So diversity and inclusion is quite an important point. It's an important point in the volunteering strategy. We've heard a lot about it. We know in the VMAC, there's projects looking particularly at inclusion. And we found that actually pretty positive responses about inclusion. This is a quote from our focus groups that, we all know inclusion is important. We don't need to be told that it's important. We don't need to talk about its importance. What we need now is resources to actually action activities and remove those barriers. And when we looked at some of the barriers that people reported in open-ended questions to inclusion, it was primarily accessibility, sort of physical barriers that were a problem. Also organisational culture, language, difficulties in recruiting a diverse cohort of volunteers, and the lack of resources to support inclusion. So I think that's really important to, what's needed next is those resources to help out and to help organisations achieve that. And bearing in mind, we know that they have small numbers of state paid staff. You have small numbers of paid staff to do this, struggling with capacity there. So we also asked specifically about employee volunteers. And what I think is really important here as the sort of big takeaway is that over half of organisations didn't really know how to get employee volunteers involved. They found it difficult to come up with the types of roles they'd be able to do. And this just seems to be a potential way of addressing that shortfall in volunteers. They're under capacity, but again, there clearly needs to be some kind of work around how to develop those roles, what sort of appropriate rules. And here you can see again one of our quotes here about the expectations that corporate groups are going to come in with, which might be difficult to meet if you're already struggling with capacity. So I've got a little bit of a summary here about some key contextual factors that came out. You know, what's working well, what are key challenges for volunteer involving organisations. To move on. So what things are going well? Inclusion and accessibility, which is great. That's wonderful. Management and governance, and the importance of recognising the value of volunteers, which, you know, we were really pleased to see as something that's moving forward. But what could be better? Now, this was a positively worded question. So it's if the score is below 3, it means there's a negative sentiment. So you can see that could be better. It's all about recruitment. It's about having those volunteers, having enough volunteer. And noting here that in a quote from our focus group that people are becoming more selective. You know, we talked a lot about people wanting more individualised volunteer roles, more tailored volunteer roles to what they want to do. And if we're struggling to get people to come back into volunteering post-COVID, we're really going to have to entice them in with attractive roles that they're going to want to do and to make it attractive to them. Another point of things that could be better. Now, this is the opposite. It's a negatively worded statement. So the higher scores reflect more negative sentiments. So all of these are above 3. They're all a little bit of concern. So, and what you can see here is it's really the organisational perspective on COVID. You know, financial strain, volunteers committing less, the volunteer programme hasn't recovered, we're struggling to engage with government and policy makers in terms of being able to deliver. And one of the points that I'll just move on to in a moment that really came out of the focus groups was just how much extra work COVID created for volunteer involving organisations, which obviously you all know because you're representing those organisations. Exactly. So yes. Lots of other people felt the same too. It's pretty much where we're coming from, which is sort of reflected here. And having to invest, and you know, just as Nicola said earlier, you know, we're past COVID. Well, we're not. COVID's going to continue to be an issue. It's opened up opportunities, but again, that's learning new skills, learning new ways of involving people, creating new roles that volunteers can do, which is all wonderful, but it's more work. It's more work for a small number of staff in what is probably already an under-resourced organisation. Trying to identify some yeah, moving through that. Trying to look at why are things changing. Obviously COVID, it's at the top, it can't be ignored. That's the main reason that things are changing, but it's not the only reason that's changing. And for us as a team, because we've been looking at volunteering in a number of projects over, you know, the last kind of couple of decades, a lot of the challenges that we've seen emerge in COVID, apart from actual sort of responding to risk and illness, are changes that have been going on for a long time. They're not new. They're not new changes. So, you know, the shift in the way in which people volunteer. Yeah, the term episodic volunteering was coined in 1995. It's not a new term, but I think it's still kind of a new way of volunteering for some organisations. There's the shifts in population and demographics. You know, we're seeing generational changes. We're also seeing COVID impact, you know, people moving away into more rural areas. There's been some demographic change in both directions, which has a factor. And although this is from another project outside of this report, I mean, we know when we've been to talk to rural communities, they've talked about, you know, people in their 20s don't volunteer. We don't get people in their 20s volunteering here. But if you look at the census, there is hardly anyone in their 20s in that community. So those things, you know, just aren't necessarily taken into account. Technological change. I mean, we're all starting to do things online, but technological change has just kind of right up in the last 3 years. And people's expectations are pretty high of how technology will work. So that's a challenge as well. And it was interesting this morning listening to one of the sessions, and they were trying to talk about new ways of engaging volunteers and saying that they don't necessarily have the systems, the management systems to support that as well. So, you know, maybe technological change isn't always keeping up with the ways in which people want to do things and the ways in which people want to connect. Climate change was very low down. So I think climate change tends to be one of those things that's really important, but it's so big it's hard to get your head around. What does it really mean? Whereas some of these other changes are much more immediate and harder to and need to be addressed. So what are our key takeaways here? Well, at the time of the survey, which was last May and June, organisations very clearly still in COVID recovery mode. Hard to know if we repeated that this year, if that had changed, and I'd be really interested to hear from you, from your organisations. Do you still consider yourself to be in that phase? There's a continued disconnect between what a lot of volunteers want to do compared to what a number of organisations need them to do, and often it's external forces that are impacting on this. It's not simply a case of we can just change our roles. We have to deliver certain things that we're contracted to deliver in certain ways, which makes it really difficult to sort of think about how those two groups can, how that tension can be resolved. And I think that's going to be one of the big challenges of the strategy in looking at that. What we are seeing is, in inclusion and diversity, really positive work, really positive changes, but a need for help, a need for resourcing to support that as well. And that recruitment and retention are they've always been the challenge, but they continue to be the challenge. There's no change there. It's just possibly COVID's just turned it all upside down and added a lot more to that. And in terms of implications from this, I'm sure no one needs to be told you need more funding. So more funding, getting rid of the bureaucracy, making it easier to involve volunteers, making it easier to volunteer. There needs to be continued meaningful engagement with the sector by government at all levels. In terms of practitioners, continuing that approach to creating tailored and flexible volunteering opportunities which are attractive to bring more people into volunteering, bring people back into volunteering. There's still that strong reliance on the traditional volunteering model, and I think a lot of unpacking, is there anything, what can be done? What are the options? Can much be done about that given the nature of what a lot of volunteering has to do? And for researchers, and I know we've got a few researchers in the room as well as up here, we've, similar to our ANU group, we've lodged a data set with the Australian Data Archive, who are here. They're here exhibiting. So there's opportunities. It's all publicly available, de-identified data. You can go in, you can get it, you can do whatever analysis you would like with that data. But importantly, we think, as I mentioned at the start, there's some real gaps in our knowledge which have come out of the research that everyone has been doing as part of the national strategy. And I think it's really important to talk about that going forward. And I've just the links if you want to have a look. But I'm also going to do a little plug for the National Volunteering Research Network, which has a session tomorrow morning at 8 o'clock, which if you think's early, I'm from WA, so that's 5 in the morning for me. And that's a real opportunity to talk about how we can take some of this research forward in a collaborative way across researchers, practitioners, policymakers to, generate some real benefit for the sector. Thank you.
Thanks, Kirsten, for that really, terrific presentation. I think there are a lot of, like you say, tensions that will need to be addressed as we move forward to implementing the strategy. And I think this report canvasses a lot of those really well. So we have a bit of time left for Q&A. So any questions for our researchers? Questions for our researchers?
You used the term employee volunteer.
Right. I'd have to look it up exactly, but This was in discussion with Volunteering Australia because there were a lot of terms. You're familiar, corporate volunteering, employee volunteering. It's people who are volunteering in their work. It's workplace organised volunteering is how I would describe it. But I would have to just double check exactly how. Yeah, we didn't separate them out. We just included as one group within the survey.
I'm from one of the state and territory peak bodies, and one of the questions we get is how many volunteers are there, in this case in Queensland? I think this question skews more towards what Nick spoke about. And obviously different methodologies produce vastly different numbers, from 14% of the population to 75% of the population, and then yours is somewhere in the middle. Is there a set number that you think people should more gravitate towards? And is it always context sensitive? And what about when people do not want the context, they just want the number?
Well, of course, the best measure is ours, regardless of any justification for that. Look, I think we just have to engage with the complexity and recognise that the context in which you're doing a survey matters, the way the question is framed matters, and just recognise that you're not going to get a definitive number. But I do think that what's more important is having consistent questions within kind of data collections. So if we look at our trends, even though it's over a shorter time period, and then say the census, you get different levels but very similar trends. If you look at the variation within our data sets compared to the census, you get very similar numbers. If you look at the general social survey, which okay, maybe you should use the ABS data. I think it's reasonably fair to say that the ABS has the resources, which it's worth looking at the ABS data as well. Just that it's not so up to date is the problem. So I think we still get very similar kind of patterns. So it's I think what to me you're not going to get a consistent number across different collections, but if you use similar methods through time or look at within samples, then I think you get very consistent findings. Matt, do you want to add to that?
It's just worth mentioning that we did actually produce data at the state and territory level that you can then get access data for a particular definition for Queensland or South Australia or so on. It's also worth mentioning that there's a relatively small number of volunteers who contribute the majority of the hours, and so they will get picked up by whatever definition of volunteering you use. And then what happens is how long a time period you ask about, or how broadly you define it, or what kind of prompts you give people to prompt them to think about whether what they do is volunteering, picks up the rest. But amongst those who contribute the vast bulk of hours, it's relatively smaller, which I'm sure you all know.
A question for both of you. I think the first one is the last presentation on the data. Did you see any split between regional areas and city areas in any of the data, or did you not look at the depth of that?
I think when we were designing the survey, we wanted to do that, but it's too, with organisations, I think it's too complex, because you have organisations that are headquartered in a city, but their volunteers are volunteering in regional areas. You've got organisations that operate over multiple states and multiple areas. So it really, so we have done, there is a piece of work, and find out from Jack what status that's in, because we have done a piece of work looking at the sort of spatial distribution of volunteering and the challenges there, which cuts across both the volunteers and the volunteer organisations. But it's almost easy. Yeah, I might pass this on to Nick
Yeah.
because I think that's more straightforward. Where are you the volunteer rather than where is the organisation?
Yeah, no, I totally agree that it's a lot easier to, with any, you find this with kind of employer-employee surveys for the paid workforce as well. It's easy, organisations are amorphous and hard to pin down, whereas people tend to have a place of usual residence. So we do find that there are some differences, and those outside of the capital cities have slightly higher rates of volunteering than those within capital cities. But really, it's other characteristics which vary more. And I think that the point about having, that some areas just have fewer people in the demographic, which might not necessarily be providing volunteering overall, but might be required to provide the particular service or particular type of volunteering which is required. So, yeah, look, I think geography mattered more during COVID, I think, than it did at other points in time, because tended to be more restrictions in urban parts of the country, but states and territory differences as well. But if I was to look for variation just in who volunteers, I would say geography is a smaller part of it compared to people's other time constraints. So whether someone, we know so for example, with hours worked, we know that people who volunteer the most are those who work a little bit but not a lot, and other characteristics more so than geography.
And my second question is just in relation to your work with the volunteers. Did you find any jobs or areas that they're interested in that they can't find volunteering opportunities for?
Yeah, so that was really interesting that that the biggest difference was a kind of working kind of with animal welfare, where and the difference we found was essentially, remember, we don't have the demand side, we just have the supply side. If you look at the areas which people want to work in compared to the areas which people are currently working in, then kind of animal welfare is the main one, and I do have a slide earlier because I thought there might be this question. So I know it's a little bit small and kind of smallish numbers. But this is the organisations where people currently volunteer, so 25% in sport and rec, and then kind of 22% in community services, and then 21% in religious or faith-based organisations. So that's the largest supply at the moment. And then when you look at the non-volunteers where they'd like to work, animal welfare, a little under a third, so 29% of those who would be interested in volunteering, where they would volunteer, the environment, children and youth. So it's not like there's a complete disconnect, because community services is reasonably high, sport and rec is reasonably high, but I think those top two, the environment and animal welfare, is the area where you have the greatest potential supply of volunteers, but maybe not necessarily. I mean, it'd be important, and we do in the paper, or the overall paper does do this comparison, that the organisations potentially which have demand for volunteers doesn't necessarily line up.
So we have animal welfare.
Yeah, it was interesting
So
that yeah, and it might well be that I mean, with animal welfare, obviously there is some roles which have particular sets of skills, and that. It might well be that there's a disconnect between the kind of the skills and qualifications which might be required for certain types of work with animals, and compared to those who haven't volunteered and might not be kind of have those skills themselves. So there is some disconnect, but maybe there is it's not necessarily a supply and demand difference, but a kind of a coordination failure. Yeah.
Okay, well, we might actually have to wrap up there, sorry, for the just so that we have time to make it over to the last plenary session at 4:30. So very sorry to do that, but I just want to say thank you so much to all our presenters. And as Kirsten said, we have a booth in the Australian Data Archive in the exhibition hall, and also both of our reports are available now at the National Strategy website if you want to. Thanks,
Yeah,
everyone.
with the data archive, are they